Lynne is a 59-year-old woman who came to see me for a consultation. She had had a prior facelift about 10 years ago and was now starting to see some of the changes in the eyebrow and cheek area, specifically descent of the eyebrows and lack of facial volume in the cheek area, giving her sort of a tired or sad appearance. And so some of the procedures that we discussed included lifting the eyebrows to an endoscopic brow lift, laser resurfacing the eyelid skin to reduce the fine lines and wrinkles, and then cheek implants to restore the volume to her face and to her cheek area.
And I just noticed it almost feels like your face is melting, for lack of a better word. Everything starts to kind of drop. And if I maintain the body weight that I want to maintain, then everybody keeps telling me my face is way too thin. Can't gain enough weight to make your face pudgy enough. Full enough. Let's use full enough. The other part of it, I guess, is that I feel like there's some heaviness through here. These brows that you're looking at now are remnants of tattooed brows. So my brows are actually lower than what you're looking at right now. And so when you pull this up, and I do this all the time, it just lifts and opens your eyes. So that's what I'm hoping we're going to end up with.
A little bit of lack of volume right in this area here, and then this part of the cheek is relatively flat, so we want to kind of round this out a bit and add a little bit of volume back in here. And there's just not enough in your face to bring it back without putting something additional.
Right.
So that's where the implant would come into play. So that's kind of the goals of the procedure there.
Yeah, and that's the biggest, that it's almost like a indentation, for lack of a better word.
Okay, so that'll get filled out with the implants, and then the brow being repositioned a little. On the day of Lynne's procedure, after marking her, she was brought to the operating room and given a twilight anesthetic so that she would not feel or remember anything. And during that procedure, the first portion is the endoscopic forehead lift, and so through very small access incisions, we can use small telescopes and instruments to suspend the eyebrows, and this is done atraumatically and really helps to speed along the recovery process. The entire surgery is done off of a television screen. During the second portion of the procedure, which was the cheek implant insertion, I made small incisions under her lip inside her mouth and placed the cheek implants through those incisions to again volumize the cheeks so that she didn't have that gaunt appearance after surgery.
As far as the results, I'm very pleased. They actually get better on a daily basis. Now that the swelling has started to go down, everything is smoothed out, so I don't have so much of the hollows. This is all very, very nice and smooth. Everybody just tells me I look rested, I look really good. Radiant was actually used.
Post-operatively, you can see that Lynne's cheeks have more volume. She does not look as gaunt. And the combination of the brow lift with the laser resurfacing of the eyelid skin has given her eyes more of a refreshed appearance. So again, we're trying to go for a natural result that still preserves her identity.
I'm very happy that I did it. I think it turned out very well, and when you consider the amount of time involved and the little bit of downtime, I think the end result is more than worth it.